My name is Martiana Young. I'm a senior at the University of Missouri Columbia. And today I will be presenting um, a webinar on social determinants of health affecting rural Americans and Missourians. I'm interested in rural communities in Missouri because I have always lived in an urban community of Kansas City, Missouri, and don't know too much about rural communities. And furthering my knowledge about these communities as an intern with Missouri Rural Health Association can help me prepare for life after college as a potential future registered nurse. Um, Registered nurses work with many patients from all over in many communities. So this um, program and internship will allow me to prepare for that. So in this presentation, I will be discussing some social determinants of health affecting Americans, Missouri's rural health in terms of the healthcare facilities, the social determinants seen the most in these communities, and ways to improve rural health in Missouri, and also improving rural health in Missouri as a whole. What social determinants of health affect rural Americans? Just to name and touch base on a few, some of the social determinants of health that has an effect on rural people are income level, which deals with employment and poverty, education, which deals with health literacy and higher education, and access to healthcare services, which deals with healthcare coverage. Income, unemployment, and poverty's impact on rural Americans. The social determinants of income level deals with employment and poverty. The average income in rural communities is much lower than that of urban and suburban areas. As you can tell from the infographic listed on this slide, the rural non-core, which are small rural areas, percentages are higher than the percentage rate of poverty as the nation as a whole. There are jobs in rural areas, but the availability is low due to the area, meaning there is not much being offered to rural people of these areas that will allow them to make a livable wage. A lot of people who live in rural areas are not given paid sick leave by their employers when they need it. And when you already don't bring enough income in, you can't afford to miss work. Education, higher education, and health literacy's impact on rural Americans. The social determinant of education deals with health literacy and higher education. Education and higher education also deals with income levels in rural Americans. The higher education you have, the more income that individual brings in. Oh, I'm so sorry. Sorry about that. These two also ties into the unemployment rate. And as you can see from the infographic provided, if a person has less than a high school education, then the unemployment rate for them is way higher than that of someone who has a bachelor's degree or higher in rural areas. Health literacy can have an impact on a rural American's life because it deals with a patient being able to understand basic health information, such as being able to take and read medications prescribed, follow physicians' orders, and managing their illness or condition. Rural Americans tend to have low health literacy because of the lower educational levels that they have as compared to other Americans living in urban and suburban areas. Healthcare system, healthcare coverage, and access to health services impact on rural Americans. A lot of people who live in rural areas are less likely to have healthcare coverage due to being unemployed or not being able to afford it through employers or privately. Access to health services can be a challenge in rural areas because there may not be enough providers, clinics, or hospitals close by for people to have access to when needed. Oftentimes, people who live in rural communities have to take off from work to go to a doctor's appointment, which can cause them to miss out on pay. Um, and typically, a person does not want to do that, so they just don't even attend to their healthcare needs. According to the infographic provided, per 10,000 people, there are only 13 physicians in rural areas versus 33 in urban areas. Only 6% of the nation's OBGYNs work in rural areas, which is really low due to the fact that birth rates are high in these communities. From 2010 to 2019, there has been many hospital closings in these communities. There has been a total of 113, making it harder for people to seek care immediately if needed.